Greetings, everyone. This is Terry Naturally with another edition of Terry Talks Nutrition. We're here every weekend, same time, same station. You can't miss us. If you're here now, just come on back where we are, and we'll be here. We love to share good science with you. Everything that I present to you in an article, study, or whatever it might be, it is science-based information. I don't make it up. It's not my belief entirely. It's not my opinion. But if you want real science information on what you can do to be healthy, healthier, and live a better lifestyle, improve the quality of your life, extend your life, and probably miss a lot of diseases over the course of your life. We just want to make you healthier. So that's why we're here. And if you think your friends, relatives, family, or whoever it might be, can use this information, please share with them where they can find us. We're going to bring you a lot of good information today. We're going to talk about a variety of topics. We're going to bring you science-based information. And right now, here's a really good featured topic. Coughs, cold, flu, and bronchitis. I'm going to help you stop pain at night. And Candida Overgrowth. And can a virus give you a heart attack? And here's some new ideas for helping traumatic brain injury and damage. How to cure epilepsy with the keto diet. The winter vomiting disease. Norovirus is back. Now is the time to protect your immune system. And the 1980s perfect storm for weight gain. There's all kinds of great information. We bring you all this information that you may improve your health, the quality of your life. Now, we're here with you for about an hour. But you can also go to my website, terrytalksnutrition.com. And there you can find all of our past newsletters. After we send you out a new newsletter, if you're a subscriber, we send it out to you every Friday to your email address. And then we archive them. So you can go over and read all the ones you missed, or pull out some that you may have read too fast. Or now you have a new problem, and maybe you want to know more about arthritis, or shingles, or cancer. If you go to the archive section, there's a place to search the articles you want to read. And that's also true for the radio show. We archive all the radio shows. You can listen to your heart's content until the moon turns blue, until the cows come home. We have all kinds of information for you. We want you to be very knowledgeable. You have more information than 99% of all doctors. Truly. If you've listened to a show or two, read a book on nutrition, you have more education, more knowledge, more insight on health than your doctor. Doctors have 3 hours of nutrition and diet when they're going through med school. Many years of med school, they get 3 hours on health and nutrition. So don't ask your doctor about diet. Don't ask your doctor about nutrition. Don't ask your doctor about what you should be eating. They don't know any better than you do. You know more. And we want you to know even more. So we're going to start off this show. And really, coughs, bronchitis are going around the world. My granddaughter in France FaceTimed me yesterday, and she has the same thing going around. She said it's all in France as well. Everybody is coughing. They have the flu. They lost their voice. They have bronchitis, sinusitis. It's out there. Do you want to avoid it? We're going to help you now learning how to avoid it. And remember, antibiotics don't help a cough caused by bacterial or viral infection, and sometimes called a chest cold. Bronchitis is when the airways in your lungs become inflamed and filled with mucus. The primary symptom of bronchitis is coughing, which can last up to weeks and weeks. What I hear from other people when they get hit with bronchitis this year, or sinusitis, or cough and cold or flu, it lasts 2 to 3 weeks at least. Now, in a new study, researchers evaluated the effectiveness of antibiotics in people with cough caused by bronchitis. Each patient underwent lab testing to determine if their infection was caused by bacteria or a virus. Now, the results of this new study, there was no difference in the duration of a cough, whether the patient received an antibiotic or not. In fact, people who received antibiotics coughed a day and a half longer than people who did get any medication at all, whether their illness was caused by bacterial or viral infection. How do we make a cough productive? And you should not try to suppress a cough. A cough is in your better advantage. Cough it out. Don't try to suppress a cough. A productive cough is how mucus is expelled from the lungs. Without coughing, mucus can't get out of your body. You can't expectorate it. You can't expel it. You can't spit it out. You can't cough it out. Cough suppressants block the urge to cough. Now, it's not nice to be coughing all the time, but they do. If you try to suppress a cough, they do nothing to reduce the inflammation or mucus production or treat the underlying bacterial or viral infection. In fact, last year, an advisory panel to the FDA recommended removing a common cough suppressant from drugstores from the list of approved OTC drugs, the medication, because there is no evidence that it actually works. Now, what really works? 2 natural herbs. Ivy, English ivy, the kind of ivy that you see on homes. Ivy will crawl up the wall, and if you don't trim it back, it's going to go right over the house. If you stand too long near ivy growth, it'll crawl right up your body. I'm just kidding. But ivy is that plant that can crawl anywhere. Ivy, English ivy, and thyme. Not the time, but Thyme, thyme. Ivy and thyme relieve coughs and mucus without suppressing the cough reflex. It also has antibacterial, antiviral effects. It reduces inflammation. It thins the mucus so it can be expelled more easily. IV extract clears up coughs better than any other cough suppressant. IV. You can buy IV tablets, IV syrup. Clinical trials of about 5,000 children, ages 2 to 12, tested the effects of an IV leaf extract to treat coughs. 71% of children had intense coughing fits. 50% were coughing several times an hour. 61% had problems with coughing at night. Now the study shows the results after using IV extract for 7 to 14 days. Children with coughing caused by viral respiratory infection saw their coughing frequency decline by 50% and coughing at night stopped almost entirely. And it's very safe. There are no side effects. Even with children, there's no side effects. Children with cough associated with bronchitis had a 30% reduction in coughing intensity and also a near elimination of coughing at night. With no side effects, no adverse events were reported. Here is something so simple, so safe, so inexpensive, not going to harm anyone. Yet it's going to give you tremendous benefits with bronchitis and coughing. So how do you use IV? Well, IV can be purchased in tablets or syrup and can be used when needed, particularly for bronchitis and upper respiratory tract infection. IV can also be taken long-term for chronic breathing problems such as COPD. Now you can take 50 to 150 milligrams of IV. That's usually about 3 tablets. Most of them are 50 milligram tablets. So that means you take 1 to 3 tablets daily. You can even take a 4 or 5 if it's really bad. Or if you want to take a syrup, an IV and thyme syrup, 880 milligrams in combination, a liquid syrup. I like the liquid syrup. I think it works faster. But either way, all the results, all the studies, all the science has proven it's more effective than over-the-counter medication. Now take it in your hands to take something that's safe, effective, and science-based. Now, let's talk about pain. Pain at night. How to stop pain at night. Is your pain worse or less at night? Almost 90% of people with chronic pain also have sleep problems, often because their pain flares up at night. A study on people with nerve pain from diabetes called neuropathy. Toes and fingers go numb. They have like prickling pain, numbing and tingling in fingers and toes. Feet go numb. Found that their pain levels were highest between 8 and 11 p.m. So at nighttime, when you're going to sleep or trying to go to sleep, they're lowest in the morning, around 11 a.m. There are many reasons why pain feels worse at night. There is a lack of certain neurotransmitters. Means that maybe the pain isn't really any worse than before, but you perceive them to be very intense. Your pain threshold is lower at night. So you feel the pain more expressed at night because the threshold is low. There are very few distractions at night to take your mind off and away from the pain that you are feeling. You might be busy. You have children asking you questions. Maybe you are at work and you are so focused on your work that you don't feel the pain. But some people have neuropathy very, very badly. Some people have to shuffle their feet because their feet are so numb they can't feel where their feet are going. They don't pick their feet up because they're afraid to, because they can't feel their feet. But you can take care of this without drugs. If you have pain at night, don't do this. Don't. Nighttime pain relievers frequently contain drugs that are called Benadryl or Benadryl. It is an anti-chologenic drug that is used to stop allergic reactions. Because it also causes sleeplessness, it is included in nighttime pain formulas. Don't take it. Why? Sleeplessness is not the only adverse effect of anti-chologenic drugs. In men with prostate problems, anti-chologenic drugs can cause urinary tract retention, problems fully emptying their bladder. They can't empty their bladder. Use Benadryl or Tylenol. Both contain this drug. Don't use these drugs. They regularly increase the risk of dementia. You won't even think of taking the drugs if you have loss of memory. And it increases the risk of dementia by 54% versus people who never took these medications. You always have to be worried about medications. There's always some side effects. There's also some adverse events. When you take natural alternatives, but you got to make sure that it's high quality natural alternatives. Anybody can make anything and make claims for it. And a lot of it can be baloney. You want something that is high quality, backed by science. That's why I am so particular about the science behind botanical extracts and natural molecules. Now, the safer way to stop pain at night, using natural pain relievers, a good combination that is a natural pain reliever. Curcumin, boswellia, DLPA, and the natural form of vitamin B6, P5P, and melatonin. Now, curcumin and boswellia, here's the science. And it has been shown in multiple clinical studies to reduce pain, knee and joint pain, headache pain, neuropathy, back pain, nighttime pain. Melatonin, in a recent clinical study in 63 adult women with fibromyalgia, melatonin reduced pain more effectively than standard drug treatment. On a pain rating scale, the drug alone reduced pain 12 points. Melatonin alone reduced pain by 17 points. And the combination that I just mentioned reduced pain by 19 points. That's very, very good. That's an excellent report. Excellent result. Now the P5P is called the biologically active form of vitamin B6. No side effects. Not like regular B6. In clinical studies shown to relieve nerve pain and used to treat carpal tunnel syndrome, it reduced pain, weakness, and numbness and night waking due to numbness and pain in adults with carpal tunnel syndrome. And DLPA will boost endorphins in the brain, the body's own natural painkillers. Now, the best time to take this combination about 30 minutes before bedtime. It'll reduce your pain and allow you to sleep better. You'll have excellent results. Science has proven it in many clinical studies. Yeast infection, Candida overgrowth, another condition that we want to avoid. What really is it? Well, Candida is a yeast infection that is naturally found in the human body. And a lack of beneficial probiotics in the gut. A diet high in sugar, stress, and the use of antibiotics that kills off the beneficial probiotics can let Candida multiply and get out of control. You can light a match and quickly put out a match. Control the fire. When a fire gets out of control, you can't control it. It's much difficult to manage it. So if you let your Candida multiply, it's hard to get back in control. And the symptoms of Candida overgrowth include oral thrush, abnormal white patches in the mouth, oral thrush, fatigue, recurrent infections throughout the body, and especially Candida, digestive issues, skin and nail fungal infections. So how do you get Candida under control? How do you get it back in check? Well, first of all, you got to get your gut healthy. Buy a lot of good probiotics. The one I like to use is 20 billion live probiotics daily, including plantarum, rhamnosus, and bifidum. These are all three of the most natural, productive, effective probiotics. And they'll last for 2 years. They won't disintegrate. They won't be damaged. And they're shelf stable. They're non-dairy. They're the ones that I think are the best to use for your results. And you can also add natural antifungals, like propolis, has been shown to reduce Candida levels easily by taking 300 milligrams twice daily. Essential oils are able to eliminate all types of pathogens, including Candida and other bacterial and yeast infections. The one I like is additional essential oils that will kill harmful bacteria in the gut without harming the beneficial bacteria. So take 75 milligrams of a concentrated blend of plant oils from cinnamon, thyme, THYME, clove, and oregano twice daily. It'll kill off all the pathogens. It'll kill off all the bacteria and viral infection and the Candida. So we're going to take a pause here in just a moment, so don't go anywhere. We're right here and we'll be here. And I don't want to break up the next scientific study I want to talk about. So we have about a minute before we break. So don't go anywhere. Stay right where you are. And if you have to leave us, you can always go back and listen to this again and again and again. I know you don't catch all what I say. I speak really fast. You know, this stuff is pretty common to me, so sometimes I speak too fast, and I know I should slow down, but that's my makeup. But when we come back after this pause, we're going to talk about if a virus, can a virus give you a heart attack. And we'll do that right after we come back from these messages. So stay right where you are. I'm Terry Naturally. This is the show that brings you all the health and nutrition information to make you healthier, to give you a better quality of life, to extend your life. I know for a fact from science that we can extend your life by 10 years. Not just 10 bad years, but 10 quality years. Good lifestyle will suit you well. We'll come back right after this, right here on Terry Talks Nutrition. And welcome back, welcome back, my friends. Well, maybe not friends anymore. Maybe you're hey, we got to turn this thing off. Well, I'm Terry Naturally. Sorry about that. This is Terry Talks Nutrition. We'll be here to the top of the hour. Lots more information coming your way. You're going to have information that's going to help you be healthier and happier with a better quality of life. Some people say, I don't want to extend my life 10 years. I feel so bad right now. I just can't stand it. I don't want all this pain. I don't want all this infection. I don't want to have a bad immune system. How can I get healthy? Well, the best way you can get healthy is listen to Terry Talks Nutrition. Now, when I went into the break, I told you when I came back, I'm going to talk about how a virus can give you a heart attack. This is something you really need to listen to. Yes, a viral infection increases the risk of heart attacks. And by the way, did you know that you are at a greater risk of a heart attack or stroke after you have had the flu? And now the flu is going around like crazy. And people actually will have a heart attack due to the flu they had the month before. And this is science-based. That's all I like to bring you. And this is based on researchers looking at the data collected in 155 studies published between 1997 and 2024. 155 studies. They look at all those studies and come up with one conclusion. That's called a meta-analysis. They use all the studies to come up with just one conclusion based on all those 155 studies. And that one study found that in the month after having the flu, the heart attack risk was 4 times higher and a stroke risk 5 times higher. Viral infections, like the flu, trigger the immune system and cause inflammation, which in turn increases the risk of blood clots, heart attacks, and strokes. How do you prevent the flu? Well, first of all, don't neglect basic vitamins and minerals. Use a really good formulation that is I would say at least 30 vitamins and minerals, including zinc and selenium. You can also add lactoferrin and propolis. Lactoferrin is a protein isolated from milk. It has no trace of milk, but some people still may be allergic. But so far, I have never found anyone that has been allergic to lactoferrin. And this milk protein, which can block the flu, influenza virus, from attaching to the cells, preventing infection, and also effective against the common cold virus, gastrointestinal infections, and the herpes virus. That's very powerful. Lactoferrin. Lactoferrin. And the reason that it's referred to as lacto, well, that's milk. Ferrin is iron. It also makes iron more effective. So if you're taking an iron supplement, and it's not very effective. If you add lactoferrin, it manages the absorption of iron. And propolis, one of my favorite multi-antimicrobial. It's a bee product used to protect their hives from bacteria and viruses. Many great studies, scientific studies, showing the ability to reduce ear infection in children and upper respiratory tract infection, including in kids. Kids over the age of 6 can use propolis. It comes in chewable tablets, comes in capsules. Propolis is really very, very powerful. About 300 milligrams twice a day. And I saw some really good research on a substance called Pluron. It's spelled P like in Peter, L-E-U-R-A-N, Pluron. It's from oyster mushrooms. It's the most active, biologically active form that's found in mushrooms. Oyster mushrooms, only in oyster mushrooms. And it keeps your own immune system ready to neutralize viruses. I've had questions about this substance. People with autoimmune diseases, like rheumatoid arthritis, psoriasis, lupus, can they use it? Yes. It does not stimulate or boost the immune system. It's a modulator. It balances the immune system. If you have an overactive immune system or an underactive immune system, it balances it. It lowers it and increases it as necessary in the body. So it's one of the most powerful multi-antimicrobials. All kinds of pathogens to keep your own immune system ready to neutralize viruses. Safe for kids over the age of 6. Reduces infection risk during cold and flu season by an amount of 50 to 60%. For kids, about 100 milligrams of vitamin C. That combination. Take them together or find them together. I've seen them in the marketplace where they are combined. 100 milligrams of vitamin C with 100 milligrams of Pluron. And a stronger one for adults is also available. Now here's some new ideas. Again, not my ideas. These are science ideas for helping you with traumatic brain injuries. How do you heal the brain? This may seem very unusual to you. You heal the gut first. The intestines first. That in turn will heal the brain. Doctors in Colorado are looking for new ways to help veterans with traumatic brain damage and injuries. They noticed that soldiers who were being treated for traumatic brain injuries and damage often complained about digestive issues. They had a higher than expected rate of IBS and gut problems. IBS have something very in common. Any kind of gut issue, digestive problem, IBS. And that common issue is inflammation. So the doctors and researchers theorized that supplemental probiotics can help reduce inflammation in the intestines or the gut and help solve inflammation associated with traumatic brain damage. Inflammation is like fire. We do need it in very small quantities for healing our body. If you slam your finger in the car door, you got lots of inflammation. Your finger is probably very hot, very painful, swollen, That's all inflammation going to work to heal that damaged finger. Now, when you have too much inflammation because of too much sugar, too much seed oil, too much stress, or a traumatic situation, you will have too much inflammation associated with brain damage. Now, research studies probiotics. Here's a study of 76 patients with severe brain injury who were admitted to the hospital and given standard treatment or standard treatment with probiotic supplementation. After just 2 weeks, the probiotic groups had lower levels of inflammation. Now, you would not normally think that way, but this has been proven scientifically. People take probiotics because they want to sweeten the intestinal tract or the gut, but they never think that it lowers the inflammation, but it does. And those that took probiotics lowered their levels of inflammation, spent less time in the hospital, had fewer complications versus a standard treatment-only group. Probiotics is so basic to our health. If you're not taking a probiotic, I definitely encourage you to do so. The one I take is 20 billion. Now, there's many out there that are higher than 20 billion. But if you take a 20 billion, it'll be like 500 billion tomorrow. It just multiplies so fast in the gut. You only need about 20 billion of 3 very effective probiotics. Plantarum, rhamnosus, bifidum. Those 3 are very, very powerful, very shelf stable, do not need refrigeration. And the count of the 20 billion will not degrade. It'll stay stable for over 2 years. The probiotic group had a 17% increase in their mental function from probiotics. You know, your intestines, your gut, is hardwired to your brain. What happens in your gut affects your brain. So the probiotic group also had a 17% increase in their mental function. This is all scientific based. I encourage everyone to take a probiotic. It also improves alertness, memory, thinking, muscle control. Probiotics is basic nutrition. Everybody should be on one. Now here's 3 things to think about when purchasing a probiotic supplement. You have to remember, probiotics are alive. They're living bugs. They happen to be the really good living bugs, not bad bugs. They're good bugs. And look for a guaranteed number of time of use, not of time of manufacturing. Many companies will put on their product, their bottle or their box of probiotics, 10 billion, 20 billion, 30 billion, or whatever, at the time of manufacturing. Because by the time you buy it, it may only be half the strength. But the one I like to buy is guaranteed to have the same number of good bugs for 2 years, at least 2 years. And the right kind is more important than the big number. The right kind of bacteria, the probiotics, is more important than a big number. I've seen products at 500 million. It doesn't do you any better. So look for probiotics that are naturally found in the human gut. They'll do you wonders. So you want to find Lactobacillus plantarum and Lactobacillus rhamnosus and Bifidum bifidum. That's a lot to remember. Those are the best form of bacteria you can use. They're natural to the human gut. They're human strains. I've even seen dog strains of probiotics in natural products for humans. Crazy, because they don't know what they're doing. They're not following the science. I follow the science because it's my body. I want to be in better health. But store them away properly, away from extreme heat and humidity. Don't put them in the refrigerator. There's too much humidity in the refrigerator. You see things sweat in the refrigerator. That's because it's so humid. You don't want it. You want it where it's dry, not where it's humid. So just keep it in a dry, dark place away from heat. Don't put it in the cupboard above the stove. Just put it away in the cupboard where there is no heat, no humidity, and no daylight. And take daily. You need it daily. You can't believe what probiotics will do for your health. Now here's something that was started in 1920. And it's still proving it to be effective today. How to cure epilepsy. One of the most easy way is to have that person adopt the ketogenic diet. The ketogenic diet stops seizures. The ketogenic diet was first used as a treatment for epileptic seizures in 1920. Today, modern science, the Johns Hopkins Children's Center in Baltimore regularly uses the keto diet to help kids with epilepsy. They have treated over 1,500 kids since 1994. So the keto diet will help all kinds of diseases, even brain diseases. And recently, they released a story of a young girl who started having seizures at the age of three, due to a rare form of epilepsy. Even with medication, she was having as many as 40 seizures a day. She was placed on a strict keto diet, 90% fat. Fat is so good for you, you can't believe it. Fat will do more for you than carbohydrates. Eat fat. Don't be afraid of fat. But now I'm saying good fat, not seed oils, but olive oil. Olive oil is not a food now this is my opinion. It's not not really my opinion. Dr. Mary Flynn said it first. She's a professor at Boston University. She has been studying olive oil for 30 years. She had said it's the only food that can cure, reverse, and treat every known disease to man, to humans, to women, to children. And this girl, her seizures quickly stopped on the keto diet, and all other medications were discontinued. Now, after 2 years, she was taken off the keto diet, and today she was cured. No more seizures, no more medication. Now she's on a modified diet of the keto diet. A few more berries, a little bit more fruit, a few more vegetables, and less fat. Now here's one that's not very common, but I'm going to give you the winter vomiting disease. And where does the vomiting disease, that's vomiting, vomiting disease. We'll have to look at this one. This is very interesting. This is a study we just ran across. Interesting study. How do you do this? Well, first of all, you keep the norovirus away. Last December, new statistics showed that the norovirus, any case of the norovirus, were doubled the usual rates of that time of year. This year, the annual raise started early, in November, and most cases are continuing to be recorded. Sometimes called a stomach bug or the winter vomiting disease. It's a norovirus, and a norovirus is highly contagious. It's a viral that causes inflammation in the stomach and intestine, resulting in severe, sudden vomiting and diarrhea. The norovirus spreads easily, contagious, so hand washing is critical, especially after using the bathroom. You don't want to pass any germs around, as the virus is transmitted through feces and vomit. If you have diarrhea, or if you're vomiting, when you have ready to leave the bathroom, wash your hands over and over again, at least for 20 to 30 seconds. Keep your immune system strong. I talked about Pluron earlier in the show. 100 to 300 to 500 milligrams of Pluron daily. The combination of lactoferrin and propolis. And the plant oils. Plant oils kill off all pathogens. They're completely side effect free, no adverse events. This is what you really want to take to be healthy. Plant oils like thyme. Now this is a double strength, triple strength, extra strength, thyme and oregano essential oils are excellent at stopping bacterial and viral infections. So these are very high potent, because this norovirus is contagious. And you can actually take thyme and oregano oil as a preventative. Usually they come in a soft gel capsule. A combination of thyme and oregano. Take one daily as a preventative. If you're one of those that comes down with every contagious infection, take it every day. These are very powerful plant oils. And take Pluron from oyster mushrooms. Pluron is the biologically active component of oyster mushrooms. It's only found in the oyster mushroom. And it's very powerful, especially for upper respiratory tract infection and for all other types of viral or bacterial infections. Prepare yourself. Don't wait until you're so sick that you lose 2 or 3 weeks of school or 2 or 3 weeks of work, and you're contaminating everybody else around you. Keep yourself strong. Keep your immune system strong. And you can use these even if you have an autoimmune disease like lupus, rheumatoid arthritis, psoriasis. These are all autoimmune diseases. Any autoimmune disease has an overactive immune system that attacks the body. So you want to slow it down. Pluron balances the immune system. It keeps you healthy. You can take it as a preventative. It does not interfere with autoimmune diseases. The ones you don't want to use is elderberry and echinacea. They stimulate the immune system. They can overdrive the immune system. So we've got to be careful with elderberry extract and echinacea. My friends, I see the clock on the wall. We're almost running out of time. I only have about a minute and a half left. But let me use this minute and a half to let you know that you can make yourself healthier and stronger no matter what. You just have to use some of these very scientifically based tips and studies and science to become more healthy. Every day, do something in regards to your health. Lower the sugar. Sugar feeds cancer cells. Sugar feeds viruses. Sugar feeds bacteria. Get rid of the sugar and the excessive carbohydrates. Lower your carbohydrates. They turn to sugar. Pasta, bread, grains, they all turn to sugar. And I see the new Quaker Oats is trying to make oats like the healthy food now. It's never been a healthy food. It's all carbohydrates. So you can make yourself healthier by taking some of these scientific tips in your daily life. So with that, my friends, I'm all out of time. Say a prayer for this crazy, crazy world, that we come back to excellence in America. God bless you, my friends. God bless this great country.
Thank you for listening to Terry Talks Nutrition Weekly Show. Don't forget to subscribe and leave a review on your favorite podcast platform, including Apple, Google, and iHeartRadio.